Lubricants are primarily used in urology, but also in other fields of medicine. For example, in surgery, gastroenterology, proctology, in gynecology, in ENT treatments, and not only for adults but also children, wherever probes or catheters must be inserted into cavities. A modern lubricant should fulfill 6 conditions. First, it should contain a lubricant that protects the urethral mucosa. It should have an antiseptic function to reduce the germ introduction in the bladder to a minimum. It should contain a local anesthetic so that catheterization can be painless for the patient. It should be highly viscous so that it remains in the urethra for a long time. This is especially necessary in surgery. It should be clear and water-soluble and have an electric conductivity. All these features are required in Cathejell. Chlorhexidine is an antiseptic and is in most Cathejell products. If a local anesthetic is necessary due to pain, there are products available that contain lidocaine. There are very few reasons why a lubricant cannot be used. Typically, these are allergies or intolerances to certain components. The biggest problem may be, for example, lidocaine, and therefore the local anesthetic. In this case, you can alternatively use a product that does not contain lidocaine. Otherwise, there are no limitations to application. There are various types of Cathejell that correspond to respective requirements. Pregnancy and breastfeeding is a particular issue. The lidocaine is absorbed. The absorption rate is very low. If it is required during pregnancy and breastfeeding, one should perform a risk assessment, as with all other cases. Each individual case must be considered. This is not a contraindication per se, unless in case of an intolerance. As a modern lubricant, Cathejell is packaged in sterile, disposable packaging. This means that once opened, the packaging should not be reused. This distinguishes modern lubricants such as Cathejell from former lubricant tubes, which of course did not have this characteristic. If those lubricant tubes are used, the risk of infection can significantly increase. The package should be ready to use and as user-friendly as possible, because often one doesn't have enough hands when using it. And therefore, it must always be optimized in use. In addition, the Accordion syringe allows easy handling. It is important that the Accordion syringe is kept down until it has been removed from the urethra, because otherwise this could result in a suction effect in the urethra, which can cause pain. Unlike other lubricants, Cathejell is steam sterilized and therefore contains no preservatives. According to catheterization standards, when performing a self-catheterization before inserting the lubricant, the patient must wash their hands. If catheterization is performed in a hospital, the person performing the catheterization must disinfect their hands. All necessary equipment should be already prepared and sterilized prior to any procedure. If gloves are used, they should be worn either by nursing staff, the patient, or a third party performing the catheterization. In this case, however, mostly non-sterile gloves are used for protection if the patient's genitals must be touched. I begin with the disinfection of the external genitalia. One must always wipe from top to bottom about 4 times. With the last wipe, I dab the urethral opening and wait for the disinfectant reaction time. Then I take the catheter lubricant from the packaging and break away the front part. You can see that the front end of the tube with the fracture point cannot hurt the urethra. Then I put the front part in place and push it, in the first few centimeters, into the urethra and insert the catheter lubricant. I pull the tube out again compressed, so that the lubricant is not pushed up again, and put the tube back in the packaging. I compress the urethra with my fingers, so that the gel cannot run out again. Then I take the catheter and catheterize from the case, without touching the catheter. Sometimes the catheter gel can clog the catheter eyes. I can use the Accordion syringe again and fix the compressed tube to the catheter. This allows urine to flow out. The advantage of using a lubricant is that the many areas of the urethra that are folded will unfold, and that a lubricant cylinder is produced in which then the catheter, the probe or the instrument can easily slide into the bladder without causing mucous membrane injury. For this reason, simply coating lubricant on the instrument, the catheter or the probe prior to insertion should be avoided. Experience shows that 2/3 of the lubricant runs back to the urethral orifice. It is therefore uneconomical and obviously also not effective to do this. In addition, by applying a lubricant with a local anesthetic, a local anesthesia of the mucous membrane is ultimately achieved. The application should be made about 10 minutes before the planned procedure. This effect is completely lost when applying a lubricant only on the surface of a catheter, a probe or instrument. The amount of lubricant depends on the indication according to area of application. In urology, we suggest between 6 and 10 milliliters if it is for a catheterization. If I want to insert an instrument into the urethra, which will remain longer during a procedure in the urethra, then amounts up to 15 milliliters should be applied. Cathejell is suitable for daily use and meets all modern standards. As the only product on the market, it has the following features. It is free of latex. It is free of parabens. It is well established by endoscopy manufacturers. Its production meets GMP requirements. It is available worldwide. It is an Austrian quality product, and it possesses a single hand-use application.